This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, November 11th, and I'm Zach Caruso. Our lead story this week is in JAMA Network Open and is titled Rapid versus Standard Induction to Injectable Extended-Release Buprenorphine. This industry-sponsored, multi-center, open-label, randomized clinical trial included 729 participants and assessed if rapid induction, or RI, for initiating extended-release buprenorphine is as safe and effective as standard induction, or SI, in individuals who inject opioids or use fentanyl. RI was well-tolerated and had higher retention than SI at extended-release buprenorphine injection 2 overall and in fentanyl-positive patients. Administering the second extended-release buprenorphine injection 1 week after the first was well tolerated in both the RI and SI arms. These findings support RI for extended-release buprenorphine induction in high-risk patients and demonstrate the feasibility of administering the first 2 doses at least 1 week apart. Next is an article also in JAMA Network Open titled Health Service Use Among Young Adults with a History of Adolescent Cannabis Use. This study used data from the Quebec Longitudinal Study of Child Development to examine associations between adolescent cannabis use between 15 to 17 years of age and later medical diagnoses between 18 to 23 years of age. Participants' cannabis use was labeled as no adolescent cannabis use, late onset infrequent use, and early onset frequent use. Individuals with early onset frequent use had higher odds of later experiencing any mental disorder and any physical condition. Late onset infrequent use was associated only with a later physical condition. The specific physical conditions associated with early onset frequent use were injury and poisoning and other physical disease. Late onset infrequent use wasn't associated with either of these. Early onset frequent cannabis use was associated with mental and physical conditions in young adulthood. Our next article is in the Journal of Studies on Alcohol and Drugs and is titled Parental Remission from Alcohol Use Disorder Shows Limited Protective Effects on Offspring Alcohol Outcomes. Using self-report data of participants in the collaborative study on the genetics of alcoholism, researchers investigated offspring alcohol use outcomes as a function of unremitted and remitted parental alcohol use disorder. Evidence that parental remission can help mitigate the risk associated with parental AUD and increase the likelihood of remission in affected offspring was limited and mixed based on continental group and sex. These nuanced outcomes highlight the complexity interplay of parental AUD status and offspring's alcohol-related behaviors. Next is an article in the Journal of Substance Use and Addiction Treatment and is titled Stigma and Knowledge About Medications for Alcohol Use Disorder Among Treatment-Seeking Adults. Researchers surveyed patients with AUD to assess factors that may be associated with initiation of medications for AUD. Researchers assessed knowledge about the medications, beliefs about efficacy, and stigma around the medications. Overall knowledge about AUD-approved medications was limited, with knowledge of naltrexone the most common. A little over half believed MAUD in general was effective in helping to treat AUD, with naltrexone viewed the most favorably. Stigma towards MAUD was reported to be very low. Researchers found that knowledge about specific medications and belief in efficacy was associated with intention to take the MAUD. Given these findings and the relative limited knowledge of MAUD, authors suggest education around this medication in this population could improve MAUD uptake. Our next article is in the Journal of the Endocrine Society and is titled GLP-1 Therapeutics and Their Emerging Role in Alcohol and Substance Use Disorders, an endocrinology primer. This is a review paper that summarizes the evidence for glucagon-like peptide 1 receptor agonists, or GLP-1RAs, in the treatment of substance use disorders. The review outlines the preclinical studies that have shown the effects of GLP-1RAs in reducing the use of various substances, including alcohol, opioids, nicotine, and psychostimulants. The authors also recap the few randomized controlled trials exploring the impact of GLP-1RAs on various substances and highlight the following areas for future research. 1. Basic science studies to understand the mechanism of action of GLP-1RAs in addiction treatment, and 2. Clinical studies to evaluate the safety and efficacy of GLP-1RAs for SUDs, as well as combination therapy with other treatments for SUDs. Next is an article in the Journal of Substance Use and Addiction Treatment and is titled Shattering the Stigma, Talking Openly About MAT in 12-Step Recovery Programs. This is a discussion of resistance to medications for opioid use disorder in some 12-step communities, authored by 3 addiction medicine physicians in long-term recovery. They note that the co-founder of Alcoholics Anonymous wrote, quote, "We have seen more than a few AA members slip badly while clinging to pills," end quote. In 2024, Narcotics Anonymous official literature stated, quote, "People on drug replacement therapy are welcome," end quote. Nevertheless, stigma persists in some groups. Families also push for abstinence-only recovery. The authors advise educating families that MOUD reduces mortality and prevents relapse. For patients, the authors reduce shame by normalizing ambivalence and sharing their lived experience in early recovery having discomfort about medication. They also use motivational interviewing techniques to explore patients' ambivalence. Recovery communities can evolve as they have in the acceptance of antidepressants. Our next article is in the Journal of General Internal Medicine and is titled, How Do We Increase Treatment for Alcohol Use Disorder in Primary Care? It Takes a Team. Alcohol use attributable deaths account for over 170,000 deaths, but less than 2% of persons with AUD receive evidence-based MAUD. The authors discuss a couple models that could increase access to MAUD in primary care settings, including coordinated care models collaborating with pharmacists and shared care models with addiction specialists initiating treatment in primary care settings. While both models offer promise, there are also barriers. The suggested interdisciplinary training programs and financial reimbursement aligned with such models could increase MAUD access and address a significant and underacknowledged public health crisis. Our final article is in the American Journal of Psychiatry and is titled, We Must Do Better on Implementing Evidence-Based Treatments for Substance Use Disorders. This editorial argues for increased implementation of contingency management, or CM, for SUDs in the United States. The authors cite numerous studies, including Coughlin's recent study, which showed an association between CM for stimulant use disorder, or STUD, and reduction in all-cause mortality. The authors emphasize that despite CM's strong evidence base, it is extremely underutilized in the U.S. In light of an increasing rate of stimulant-related overdose deaths, the implementation of CM for STUD is increasingly critical. The authors argue that we have an obligation to improve access to CM for a variety of SUDs, particularly given that strong data for CM has existed for over 30 years. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.